Health promotion and maintenance. 1. Which of the observations made by the nurse when examining a newborn who is a month-old calls for additional research? Select all that apply. A. Inspiratory grunt. B. Nasal flaring. C. Cyanosis. D. Asymmetrical chest movement. E. Abdominal respirations. F. Irregular breathing rate. G. Increased heart rate upon crying. H. Good sucking reflex. Correct answers: A, B, C, D. Rationale. Option A. A baby will grunt when it makes a partial glottic closure in an effort to preserve a sufficient functional residual capacity in the face of poorly compliant lungs. There is a longer and increased residual volume that maintains the airway opened while the newborn prolongs the expiratory phase against this partially closed glottis, as well as an audible expiratory sound. Option B. Nasal flaring, which happens when the nostrils enlarge when you breathe, is an indication of breathing problems or respiratory distress. Option C. Cyanosis describes the skin's bluish tint and denotes a reduction in the amount of oxygen bound to red blood cells in the bloodstream. Option D. When the abnormal side of the lungs expands less and lags behind the normal side, asymmetric chest movement ensues. This indicates respiratory distress. Other options. In newborns and early children, abdominal respiration is typical. They utilize their abdominal muscles much more to draw the diaphragm down for breathing because their intercostal muscles are still growing. With intermittent short-term apnea, newborns can have erratic breathing patterns ranging from 30 to 60 breaths per minute, 15 seconds. While an infant is engaged in exercise, an increase in heart rate is normal, including crying. When a newborn's behavioral state changes, such as when they cry, move, or become awake, their heart rate will vary as well. Pharmacological and parenteral therapies too. At a shift change, a nurse is examining a patient's medicine. Which of the following drugs should the patient not take if she is pregnant? Select all that apply. A. Celecoxib, Celebrex. B. Clonidine, Catapris. C. Transdermal nicotine, Habitril. D. Clofazimine, Lamprine. E. Warfarin, Coumadin. F. Finasteride, Propecia, Proscar. Correct answers: E and F. Rationale. Warfarin, Coumadin. It has pregnancy category X and is associated with CNS damage, spontaneous abortion, stillbirth, premature birth, bleeding and eye damage when administered at any time during pregnancy, and fetal warfarin syndrome when administered during the first trimester. Finasteride, Propecia, Proscar. It also has pregnancy category X, which carries a high risk of permanent damage to the fetus. Celecoxib, Celebrex. High doses cause birth defects in rabbits. Category C pregnancy. Clonidine, Catapris. Crosses the placenta, but no harmful effects on the fetus have been observed. Transdermal nicotine, Habitril. Nicotine replacement products are divided into pregnancy categories C, nicotine gum, and category D, depots, inhalers and nicotine sprays. Clofazimine, Lamprine. Clofazimine is classified as pregnancy category C. Physiological adaptation 3. The patient's chart shows a history of hyperkalemia. Which of the following would not be expected to be seen in this patient if this condition were acute? A. Decreased hour. B. Migraines. C. Muscle weakness of the extremities. D. Paresthesia. Correct answer: B. Migraines. Rationale. Migraine is not a symptom of hyperkalemia. Symptoms of hyperkalemia, if present, are nonspecific and are primarily related to muscle or cardiac function. Cardiac examination may occasionally reveal extrasystoles, pauses, or bradycardia due to heart block, or tachypnea due to respiratory muscle weakness. Paresthesia refer to a burning or tingling sensation usually felt in the hands, arms, legs, or feet, which is common in hyperkalemia. There may be skeletal muscle weakness and weak paralysis, as well as depression or absence of deep tendon reflexes. Want more of this? Visit our channel.